And welcome back. I'm Mabel, Jong. You're watching continuing coverage of the World Healthcare Congress in Washington, D.C. And in our studio, we have Dr. Sarika Aggarwal, who is the Chief Medical Officer at Beth Israel Deaconess Care Organization. And Dr. Aggarwal, you'll be sitting on a panel in a little bit.
Yes, around 1:20.
Okay. Tell me what some of the issues you'll be covering in that panel.
So our panel is really using the data analytics to help providers, both physician providers and other clinical providers, to really execute on their programs. So it's really a real-time tactics, engagement strategies related to executing the programs.
Well, we certainly have a lot of access to data now, strategies to gather even more data. Are we finding that organizations are engaging with it correctly and using it in the most efficient way possible?
So the data analytics for healthcare, it's almost a revolution. And, you know, baseball had a similar revolution. They had the Moneyball statistical revolution. And really they went from hunches to real-time data-directed play. And I think in the value-based world, that is what is happening. When you take risk, you have to anticipate risk, you have to remediate risk, you have to understand what the variation is in cost and quality, and you have to implement programs and then evaluate the programs. And so you really need to be data-directed and data-supported. The organizations are on different parts of that curve towards data analytics, but I don't know of any organization that is not on that path, including ours.
So is there any sort of guidance you can provide based on the information and experience you have at Beth Israel?
So, you know, physicians are scientists. They're fiercely independent. They you know, do understand evidence base. And so I think the data analytics needs to really be in that space to engage physicians. And this includes giving it to them real time. It includes taking away the noise. So you only want to, you have to measure because you cannot manage what you cannot measure, but you just don't want to measure for the sake of it. You want to really give them measurements on what they can manage. So you have to be very clear with your goals. You have to give them the tools and the data to manage those goals. And I think that helping them incorporate the data into their workflow and maybe delegate some of the workflow to the non-physician care team really helps them.
Okay. So because I was going to add to that, is there frustration amongst physicians that they're already complaining about too much screen time, and to add that data piece to it and get them engaged to it, is that challenging?
It is challenging, and I think, again, I think a lot of the data can be really directed to the top of license care team, so it doesn't have to be providers. There are certain parts that need to go to the provider leadership. There are pieces that, for example, there's a lot of work that can be done pre-visit. If a diabetic comes in, you can do a lot of pre-visit planning based on scheduling data, based on gaps in care data, and all of that can be incorporated into the care team. It can be a medical assistant, it can be someone who actually sees the patient 2 weeks prior, maybe an advanced practitioner, and then the physician really can do their top of license work, which is the medical management. So I think that as long as it is attributed to the care team, a lot of the physician responsibilities in terms of, you know, EMR time can be reduced.
What are some of the questions that you're hoping to get answered during the panel from your point of view? So,
you know, I think the way we proceed at the BI, at BITCO really with data is using principles of behavioral economics. So we really like to think of physicians, and just like other human beings, liking status quo They really don't want to change.
Yes.
They're doing a great job. They're taking care of patients. And so how do we work so that we can help them in that status quo bias? How do we sort of work around that? And again, it's about automating. It's about delegating. It's about incorporating all the things that I said. Activating the patients. That's important. All of these things can be done with their permission around them. The second piece is we need to give them, there's immediacy, so the data needs to be real time. There's things that you can do with retrospective data. For example, patients who've come into the ER multiple times. But if you know real time, there's a patient waiting in the ER, can you, instead of having that patient get admitted, arrange for IV antibiotics at home? Can you send them straight to the SNF? So immediacy of data. And immediacy of feedback. So if you're telling them you have these gaps and the medical assistant is filling them, can we give you in 2 weeks the feedback? So immediacy of feedback. They also, they want intermediate goals. So the ultimate goal may be to improve ED utilization by 15%. But maybe we can give them short-term intermediate goals. And so goal gradients are really important. Social ranking, again, physicians are very competitive, fiercely competitive. And the competition can be at the institution level, the competitors at the institution level. The competition can be at the physician and pod level. So we are very transparent with all our physicians. We have what we call a heat map. So I personally call it the bloodbath to green pasture. So we have green for the physicians who are leading and red for the physicians who are lagging. And we try to, it isn't just the physician responsibility, it's the care team responsibility, but we show the physicians how they're moving from the bloodbath to the green pastures. So.
Well put. It's hard to erase that image when you put it
It is.
that way.
Colors are deliberate.
Yeah.
People are very visual, and physicians and providers just like any others. So.
All right, Dr. Aggarwal, thank you so much for your time today.
Okay.
Pleasure.
All right. Thank you very much.
And we're going to have much more content to come. Please stay with us. Thank you.
Okay.